And I'm going to share my screen.
Okay, and I'm going to have a few housekeeping information to share. Good afternoon, everyone. My name is Nancy Allen. I serve as Executive Director for the National Consortium for Health Science Education. I hope that you've had an opportunity to attend some of our webinars. We do these free webinars 2 to 4 times a month as a way of providing professional development for you, especially you, the classroom teacher. You can always go to our website at healthscienceconsortium.org to the events, and there you'll find the upcoming webinars. We do have one next week on a closer look at the medical assisting profession. So if that's something that interests you, or you're thinking about certifications that you can provide for your students at the high school level, we invite you to attend that. They're always at 4 o'clock Eastern time. We do record the webinars when I remember, and today I did remember, so it's being recorded. We do record them and we archive them on our website at healthscienceconsortium.org/webinars. And this webinar today will be recorded, and you can find it there probably in about a week, along with the PowerPoint that Ellen and Erika are going to share with us. We do provide certificates of participation for 1 hour of professional development. And I'm going to put the email address in the chat where you can request that. If that is something that's helpful to you to document your professional development, then we want you to have access to that. And we're happy to provide you with a certificate of participation. If there are any special topics that you ever want us to consider for a webinar, I invite you to put those here in the chat or email me if you have suggestions of speakers or certain topics that would be helpful to you as classroom teachers. That's what we're here for. So with that, this webinar today will have sort of a hard stop at 5 o'clock, but during that time, I will take questions. I don't know if you heard Ellen and Erika, they were with us about it was in November of last year. They both have expertise in health science and as educators, and they have been very popular to provide professional development, and we just appreciate their willingness to do another one for us on difficult content. And so with that, they're from Georgia, and they may have more to share about themselves. They have some kind of unique nicknames, I think. So with that, I'm going to pass them the microphone and look forward to a great webinar. Thanks, Ellen and Erika.
Thank you.
You are welcome.
Okay, you guys can hear, right? Okay, so this is really hard, I think. This was brand new to me. I did a lot of research, and I'm probably going to go into my New York mode and speak fast because I want to get all this information out to you. But if I speak too fast, put it in the chat like, whoa, slow down. Erika's going to be answering the chat. You guys are muted until the end. But if there's a concept that you don't understand, Erika will answer it, or we will answer it at the end. Or if I'm too fast, just tell me, hey, you're not in New York anymore. And I'm not, I'm in Georgia. So a little bit about me. I was originally a laboratory scientist, and I taught microbiology for many years. And then all of a sudden I had a master's in education, and I was teaching healthcare science. I mean, it was like that. It was just like, I don't know, it was like a magician. So I taught for 25 years. I retired, and then I went back into the laboratory, into microbiology, back again, because microbiology, they're not like the students. The bacteria, they don't talk back to you. So it was nice for a while. And then somewhere along the line, Erika, who was my boss, I said to her one day, we were actually at a national consortium, one of the conferences, and we were in a session, and it just came to me, and I remember writing Erika a little note. I said, Erika, let's go into business. And she goes, what? You've lost your mind. And we started this little business for homeschoolers because they don't have that much of an opportunity. Anyway, it evolved into something it is today, where we write modules, we do webinars, we now have expertise on doing webinars, and we love it. We love to hang out with you guys. So I think, Erika, your turn.
Now, okay, a little bit about myself. I am surprised, not actually a healthcare science teacher. I am a science teacher by trade, a broad field science teacher, which comes in handy when we're talking about the body systems, everything. But I'm broad field science. I am also a teacher support specialist. So I am one of those that has my PhD, and I can take the information and say, okay, how do we take something hard like this and bring it down to something that kids can really understand? So we work really good together, although we call ourselves the Lucy and Ethel of education and webinars. So as we continue through this, some of you will figure out quickly who is Lucy and who is Ethel. Okay, so as we get started in this, we want to go through some general disclaimers about our sessions today. As Kat said, if you have any questions, feel free to put them into the chat. I will answer them as I can because, as I said, my background is not healthcare science. So I will answer what I can. If I can't, then I will hold it to the end for Ellen to answer. Okay. Other disclaimers is as we look at standards, we know that some of these standards repeat throughout different courses. And so some of the things that we will talk about may be a teacher prior to you has done it, or is something that you're covering that's brand new. And hopefully we can have enough information in to help both the new teacher as well as the teacher who's been teaching this for a long time. As we mentioned, Ellen has worked, retired, worked again, retired. And this is my 28th, 29th year in education. And one of the things that we've noticed is everything old is new again. Some of the things have been rebranded and everything. So we're taking some of the best things, the best practices that we've had over the years. We've modernized them and improved on them and made them better for the actual classrooms and the things that we have to do. We usually have to mention safety with a lot of the activities and stuff that we do. This webinar today is not going to have as much safety stuff because they're not working with scalpels or needles or anything like that. This is health information and health informatics. And so I would say the safety that we're looking for is probably HIPAA safety, with making sure that you are cautious of what you're saying and what you're doing when it comes to patient healthcare records. Okay, we usually have the kids as a general practice. They always wash their hands. They always are ready so that they get that habit. And with COVID, they need to be washing their hands as frequently as they can anyway. And with all of the things that we have rubrics and competency skill sheets, all of those things to help better evaluate the kids as they go through some of the activities. Feel free to use ours. We will have them in the webinar as well as in the PowerPoint that you will have access to, but you can use your own as well. The standards that we're going to be looking at today are the standards in healthcare information technology and biotechnology. What I think is interesting is that even if you are, whether you're in healthcare science, biology, whatever, we all have those subjects that we need to get to. Sometimes we run out of time to get to them, and we have the ones that we don't like. So we put to the end, and some of them that we're not comfortable with, and we normally will like move those to the end of the year, and hopefully we'll run out of time. And we noticed that healthcare, IT, and health informatics is one of those areas that a lot of teachers push to the back burner but the kids need to know it. And I think a lot, and as Ellen and I were talking about, a lot of teachers are not comfortable teaching it. And so we want to give you guys some practical skills to help you actually teach this unit. So with the standards, we're going to explain the strategies used in the field of health informatics and health information technology to protect and ensure patient privacy. We're going to talk about HIPAA, identifying the components of the electronic healthcare records, the difference between the healthcare record and the electronic medical records, looking at history, medication, patient demographics, things of that nature. Next slide. Okay, we're also going to explore the different types of data and tools used, telemedicine and telehealth. We have a good resource for telemedicine and telehealth if we don't run out of time. Creating the electronic documentation that reflects timeliness. As we said, the difference between the health records and the medical, and adhering to the policies and procedures and regulations by the state, national, and local entities. And of course, we said HIPAA. Cannot mention HIPAA enough.
Okay, so normally we give you information to give to your students and we don't lecture. But in this case, I am sorry, I'm going to have to do some lecturing because you won't be able to do these activities if you don't understand the information. I asked my health science coordinator at the state, I said, how many healthcare science or health science teachers are actually in this field? She said none. So at that point, I decided some of you might need a little background, but we will role play certain activities. You will have exercises to use for your students. Okay, we will start with HIPAA. You are familiar with HIPAA. I mean, from as a healthcare provider and as a teacher. And it was enacted in 1996 because we had to make sure that that information was not released without the patient knowing it. And I'm sure if you work outside of teaching, I'm sure you have seen HIPAA become on steroids since 1996. I know I did when I went back to the hospital. It was like, whoa, this is crazy. And so there's been stricter mandates, and HIPAA is followed by healthcare providers, the doctors, hospitals, nursing homes, etc., along with insurance companies, HMOs, Medicare, Medicaid. It seems like just about everybody has to follow HIPAA. I don't know if veterinarians do. I meant to ask my vet last time I took my dog in. So a HIPAA form is signed when you first go to your physician right away. They tell you here, they give you all this information, you sign everything, you don't know what you're signing. I mean, who reads these forms? But one of those forms is a HIPAA sign, a signature, and they might say, this is for HIPAA, the Privacy Act. So who needs these? Why do we have to have these forms? Well, sometimes patients need their records, and patients are allowed to have their records. And if you're at a physician and the physician gave you an order to have an x-ray and the physician needs to see that x-ray, you guys, or we need to have that form signed in order for your x-ray to be signed and transferred to the provider. That release form is needed. And so the patients have control over their health information. And a lot of patients don't know that they are allowed to receive copies and they have the right to have their information. And we're going to talk a little bit more about that later when we talk about a patient portal and things of that nature. However, the patient information should be kept up to date. And when you ask, I mean, you might have to pay a little bit of a fee, but it's still yours. And don't let them tell you that it's not. All right, so these are some of, just some of the HIPAA violations. Gossiping, being careless, there's theft, hacking, and there are, wait, I'm just going to go back to make sure, yeah. And there are other ways to violate HIPAA, even if there's no nefarious intent. And I was so surprised to read this, that in 2019, there were over 400 HIPAA violations reported, which led to almost 35 million Americans that had their PHI, which is their protected health information, breached. That is 10% of the population, guys. That's a lot. There should be, and well, not there is specialists that are hired by hospitals or physician offices or clinics that access the technology and find if there are problem areas. They are employed for that person, for that problem alone. And they're trained to be in order to catch this. These are two of my many personal experience with HIPAA violation. Now, we didn't talk about it. We'll talk about it later, but we have a module that we sell, and I gave 2 on this PowerPoint because we didn't have enough time. But I think in that module there are about 6. But I'm sure you have your own personal experiences. So this happened to me. I was taking PT, and it was in a large place, and there was a lot of physical therapists, a lot of people, and I didn't have the same one again and again. I was rotated around. So one day there was somebody I had never had before, and he came in, and he said, "Oh, Dr. Katzowitz, I believe we know somebody. We know somebody that's the same." And I said, "Oh yeah, who?" Now I have an uncommon last name, Katzowitz, and they said the name of my relative, and I said, "Yeah," and he said, "Well, she's my boss, and I told her that I'm going to have you as a patient today." And I was like almost appalled. I was appalled. I was like, what is he discussing me with my relative? Well, he looked at which patients he had that day, and he saw my name, and he Katzowitz, and he went to his boss and said, "Hey, you know this person?" With any of these experiences, you guys can share these with your students and pose the question, what would you do? Now, there's what should you do, what would you do, what can you do? It's a lot of gray there. So what would you do? Now, here's another thing that happened, and it was just about a month ago. I was at my orthopedist, and I was speaking with the specialist in charge of getting specialty shots. I have a bum knee, and she had a cousin who I taught several years ago, and she said, "Hey, do you remember?" And she told me the person's name, my student's name. And I said, "Yeah, of course." And she gave me all this wonderful information. And I was like, "Oh my gosh, it's so awesome." And I said, I don't know why I said it. I said, "Does she know of our connection?" And she says, "Oh yeah, of course." And I thought, HIPAA violation. What would you do? What would your students do? What could you do? So that was 2 of my personal experiences. Now, some of these, I'm going to be giving you a lot of forms that you could share with your students. So it will be easier for you to do when you do the standard, which in the national health standards in the consortium, I think it's the last standard that has been put in. So you have to teach it, guys. I hate to tell you this, you have to teach it. It's difficult. So this is just one, and this is upon the first visit that you sign. Now, this next form is releasing of information to the third party. So if you're going to one specialist to another specialist and they need their information, you have laboratory results that one provider has and you needed to go to another. You have to sign this. And if you can't, if you don't, they won't send it because it's HIPAA and it's your protection, for your protection.
Can I call and ask them to release it? Can I just do a phone call?
Oh, no. And that's a good point. No. And a lot of times they won't even, in my experience, I had to fax it. I could not do it via email. It was faxed or come in and provide it because the internet isn't as safe, isn't as secure. Now, this is just for your information only. Because we do this E Squared Educational Experiences is our little company. And we work with an agency to certify students in HIPAA and OSHA or OSHA. There are two of them. And I used to do this with my students all the time. And it's pretty easy. It's a 30 to 40 minute course. And then it's online. They administer a test. And if the student passes the test, they will be issued a certificate for HIPAA and or OSHA and or both, which my students loved. I remember students love certificates like the kindergartners like stickers. So this is great for a resume, a transcript, a job application, and they can have this. And even if they go work in a hospital, they could just drag this along and it gives them a little bit of a leg up. And we'll talk about at the very end. This is an activity for you to do with your students. And again, we have more in our health informatics module. The directions are to do in a group activity of 3 or 4, however you decide to do it with your situation, with being with COVID, you just figure it out. So the students learn the information about HIPAA, and then they decide whether or not it's a HIPAA violation. So this was actually a true story. There was an employee at an orthodontist office. Okay, yes, so dentists do have to have HIPAA. Okay, I just answered my own question. Gosh, I should have known this. I've only read this PowerPoint 5,000 times. Well, there was an employee from an orthodontist office. They were reviewing patient reviews on Yelp, which is a social platform that I'm sure you're familiar with, and it rates and reviews businesses. And I don't know what happened, but all of a sudden there was all this confidential information about a patient that was released. Their treatment, their name, insurance information, facts, cost of treatment, HIPAA violation or not. Of course, it was a true story and a HIPAA violation. There was no reason listed. Nobody knows why this happened. Maybe it was carelessness. Anyway, the office was sued for an incredible sum of money. That's what I remember or read. Now, this next scenario actually happened to me. And a group of laboratory technologists were discussing in 1994 when I was working in the hospital. They were talking about a patient who did not have a diagnosis yet, but had very unusual lab results and had very unusual symptoms. So we were eating breakfast in the cafeteria while we were discussing this very interesting patient. And unbeknownst to us, horrifyingly enough, the patient's family was sitting at the nearby table and heard the conversation. Oh my God. HIPAA violation or not? I know, you go, I got this. Well, guess what? It wasn't. Because I know I see somebody's shocked faces there. The date was 1994. However, the family members complained and the laboratory techs were reprimanded. No, I was part of this, or I was sitting quietly and listening. My mouth was shut, but we never had
Hard to believe.
Yeah, nothing ever went in our record. It was before HIPAA. All right, next slide, come on. Okay, our next subject is EMR, electronic medical records, versus EHR, electronic health records. Yikes, they are not interchangeable. No, 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 they're not. Have I made myself clear? EMRs are simply, no, it's nothing is simple about this, but they're digital versions of patients' charts that are in one physician's office. And what it does, it has their medical information and their treatment, maybe doctor's notes, maybe nurse's notes of that particular patient in the office. And sometimes, and most of the time, it is not any better than just a hard copy, than just photocopying this. Now, with the EHR, that they do all of that and more. I'm going to give you a quick example. It's not on the PowerPoint, but years ago, I had breast cancer and I was at Emory. Well, they were part of an EHR, electronic health records. That means I was in one facility and every doctor and person that I used had the same information. Everybody had information from the oncologist to the surgeon, to the radiologist, to the lab people, to the where I had to get radiation, et cetera, that they shared all of this information with each other. And that's what I put in there. They are obtained and everybody has information. I was at Emory, which is a very big hospital in Atlanta, and there's a lot of Emory hospitals. So everybody has access to this information. Well, everybody, well, maybe not the cleaning people or the people that cut the grass, but anybody that had anything to do with me. So
I have a question.
Well, just let me finish.
Okay.
One second. So we had a team of all clinicians involved in my well-being, and they were allowed to share their information. Okay, Dr. Imes, what is it?
So if my husband's crazy ex-wife worked as a receptionist at Emory Healthcare, could she have access to my medical records?
No, if she has nothing to do with you, the answer is no. And no, she has no access. And if she's caught looking at your information, and they do checks, and working in the hospital, they do checks, they have their checks and balances. If she gets caught, she could be subject to disciplinary action or actually being fired. So you could worry about this woman. You don't have to worry about her.
Okay, so this comes up to the other analogy that we talked about. I knew the answer to that. I just wanted to throw that in I don't have a crazy ex-wife back there husband thing, but I just wanted to throw that out. So the analogy that we use for who can see the records and who should have access to it is we're in the classroom. So in our classrooms, we have access to all the kids' education record, or most of their education records that we need to know for that kid in our classroom. When I was magnet coordinator, which was an administrative level, I had more access, not just to the kids in my classroom, but the entire school and anybody who was interested in applying to our program. But that was it. As the principal of the school, he had access to everybody's and all of the feeder schools that came in. And if you're a superintendent, you have everybody's. So that is a way that they help to see who can and who cannot get access to the records. Think of it as our education records. What do we have access to and why do we have it versus someone else who needs a little bit more?
Thank you. Good point. Good analogy. So the EMR versus the EHR, a little bit more. EHR has become more noticeable in the last several years. For example, the patient portal. most of you are familiar now with the patient portal. You don't have to call and make an appointment. You don't have to wait for the doctor to call and give you results. Sign up for the patient portal. It's all there. You can leave messages, you can get your medication, etc., etc. And that's part of the EHR. I mean, and there are very, very fine differences in some respects. Now, pharmacists that are in the system can see the medications that are prescribed to them by their physician. So if there are two medications that contraindicate each other and aren't good for each other, the pharmacist should pick it up, hopefully, and say, no, you can't mix those two medications. So this benefits the patient's total health. Okay, so for me to summarize it, they're both digital records of the patient's medical information. The EMR is really the digital version of the patient's chart. That's what it is. But the EHR contains the patient's chart that can go to different doctors and different facilities. And it's more of a holistic, longitudinal view of the patient, into the patient. And that's the major difference. So the EHR encompasses it all. Some parts of them, well, diagnostic tests. In both of them, if there are lab results, the normals are listed. So if the doctor doesn't know, was it 175 that's normal, or is 176 high? Well, it's right there. They just have to look over to see if it's normal or not. The history and physical, hopefully this medical record that's created covers the lifetime of a patient. So it's longitudinal, which reports can be created over time and then gone back and looked over it. Medications is really important because we know the stereotype of a physician, that they're bad handwriting, and pharmacists have a hard time reading that. And if the pharmacist doesn't go the extra mile to call the physician and say, was that a T or a P? Sometimes they will give the wrong medication or the wrong dosage. Well, when the physician has to type, or whoever at the office has to type it in, there's no problem for the pharmacist to be able to see what actually is written. Demographics is really important because it includes age and race and gender and ethnicity. And sometimes when demographics are understood, there are other decisions that need to be made that we don't even think about. I'll give you an example. And this is factual. African-American males are known to have higher blood pressure than Caucasian males. It's a fact. It's a fact. It's been documented. So if we know that the race is African-American and the blood pressure is high, that's not going to be a surprise. Now, I'm Jewish. I'm an Ashkenazi Jew. And Ashkenazi Jews have all these things like Tay-Sachs and other things that are just known to be for Ashkenazi Jews. I can't even pronounce it. Sickle cell. Well, sickle cell used to be pretty much African American, but it's not so much anymore. But that's what it used to be. So it's really important to have these demographics. And of course, the treatment plan is a document that follows the patient, and the patient has certain goals, even different treatment, even different plans, exercise plans, eating plans, nutrition. The patient can reach these goals with this EHR. All right, we're going on to the next topic, and I know I'm covering this quickly, guys. Who can explain the difference between health informatics and about health information technology? Oh gosh, again, a lot of interchangeable. Well, what happens is the health informatics actually means obtaining retrieving and then using the patient information to support the patient amongst the different facilities, the different clinicians. This is a relatively new field, and it actually combines the information technology, communication, and the different healthcare occupations. Ultimately, this becomes digital. And again, of course, it's used in order to better the patient for the long term. That's why we're starting to live longer. I was really stuck on this health information technology. Actually, it can be something as simple as checking the patient in, or updating their medical records, sending their blood work to the portal, sending notes to the portal. This is the part of healthcare that supervises all the different technologies. It keeps the technology, it keeps the system running efficiently. And this could be private facilities, public clinics, hospitals, doctors' offices, PT facilities, etc. So this was confusing to me. HIT uses the electronic health records, including their technology tools, which lets the patients reach their health goals. And I'm sure you guys have gotten things from your health insurance and said, hey, join this. And you could get maybe money towards, what are these called? These watches, or what am I thinking of?
Smartwatch.
Yeah. And so insurance companies are doing this too. That's part of the HIT. And so if you are documenting, I know Erika is using it because she has to get up every hour and start moving. So if she starts moving, don't take that she's getting antsy or she has to go to the bathroom. Her watch is telling her to move. That's part of health information technology. So patients are giving more power over their health through the different applications. Erika's using her watch. She drove me crazy when we were working on this PowerPoint, just crazy. And it's also advances are actually having people of the healthcare team have better communication amongst themselves and their patient. And then there is actually different, there's the things that you don't think about with health information technology. People have to work on the computers. So there has to be technology people. There might be graphic designers because these have to be pleasing to the eye. So it's from soups to nuts, ultimately decreasing human error and improving the outcomes, the health of the patient. All right, one last time. The difference between health informatics and the health information technology is that informatics is concerned with managing the databases of patients, whereas health information is affected with managing the data. Okay, I bolded that because I wanted us to really remember that. Okay, next point, telemedicine. Over COVID time, I know I have been more familiar with telemedicine. I'm sure you have been more familiar with telemedicine. And I'm going to speed it up a little bit because we are running out of time. There are 3 parts of telemedicine, but we're only going to talk about one part, and that's teleconsultation. But telemedicine is real time. You could be done anytime, anywhere. I know when I was doing it in the beginning of COVID, I was actually doing telemedicine with my physical therapist. Now, she was using Zoom at the time, but they don't use, the physicians, they don't use that anymore because it's so easily breached. So they use some platforms such as Mend, Doxy.me, and other platforms that I'm not familiar with. So what do? What happens? Well, you could need to make an appointment. And this can be done scheduling an appointment with the telephone, old school, going through the portal or through the provider's webpage. Then the patient receives a text message with a link asking if this appointment is okay with them. And they're provided, if that's the case, they're provided with a link to join the provider in a secure conference call. And the patient is then connected to either the physician or a medical assistant or a nurse or somebody who will ask them some just basic questions before being joined by the physician. So what are the logistics? Well, if you are an established patient, the physician will have your chart during the visit so they can look at it. New patients have to fill out forms online, which their office can mail, or you can get them via US or get them through your email or the website. And you'll have to answer questions sometimes prior to the visit. And then of course, they're going to be paid. There's no doubt about that, either before or after the visit. Okay, and we talked a little about this, your appointment, the health provider asks about problems, health, injuries, family history, etc. Many healthcare providers can easily do a telemedicine visit. Psychiatrist, gastroenterologist, they don't have to physically look at the patient, but there are many physicians that cannot. So if there is a medical condition that the physician has to physically examine the patient needs to go in to visit the doctor. However, the doctor can order tests prior to this that he or she would have at their disposal and get the patient out quicker than normal.
I'll add to this while she's going over this. One of my good friends, my college roommate, is actually a physician that does only telemedicine. And she has a great podcast that she does every week, Tuesday nights at 7:45, called A Friend Who's a Doc. If we have time at the end, I'll show you some of the topics that she's done. Last week's topic was student stress, but she also goes into some details in one of the webinars. We're not going to be able to watch a little segment of it from her. And it is about how they can use your camera on your computer and all those different things to look at you. And then if you have a heart problem, you can order something off of Amazon and they put it into the computer and they can read those kind of things. So telemedicine has come a long way. So if we have time, I'll give you more information, but we have so much more to cover.
All right, etiquette. It must be stressed. The provider must have a quality webcam and a good platform. Professional space set up, like not their bedroom, but where maybe you could see diplomas on the wall. They have to dress professional in a lab coat. They need to know the complaint prior to this and have the chart ready. They have to know how to engage the patient, how to ask the proper questions, and they must make sure that the patient understands any post-appointment instructions. I mean, this is like critical. The next few slides, I'm not going to really comment on them, just making sure, are forms that you could use at your discretion. But this can be a form for an appointment. This is what the patient portal looks like. These are just sheets that you fill out prior to your visit. And it's just like having a regular visit. More forms, more forms. So here's our next student activity. You designate 3 students to a group. Now, part 1, there will be a student that will be the physician or provider, the student that will be the patient, and then you have one student video the telemedicine visit so they can go back and see how they did. If time allows, rotate the kids. Now the next part of it, which is really important, The students will determine or find the physicians or providers that they want to use. That would be easy to telemedicine. The students will also pick a diagnosis to, let's say, a psychiatrist. Say a diagnosis would be anxiety. They have to research both the psychiatrist and the diagnosis, anxiety, and be able to ask the appropriate questions to give them a diagnosis or a prescription or whatever. So I'm going to give you an example in a minute. Oh, and here it is. Here we go. It's right on the slide. So you could use things, some of these examples or your own, and your group will give you beforehand the type of physician or provider and the type of patient and why they need the telemedicine visit. So they have to do research on this. And you can use any of those forms that we have provided. And the students need to know how to make an appointment and how to log on, and making sure they use etiquette if they're the physician. And actually, if they're the patient, they're not coming in their pajamas. All right.
Ellen, there's a question about if the forms are digitally fillable. I'm sure they aren't from the PowerPoint, but I didn't know if that was something that you would share to accompany the PowerPoint.
No, they're they could share. They're on the PowerPoint. They're
but
not a PDF.
Okay.
All right. So yes, print it out. Here is poor little Madison. She wasn't feeling well. She was running a low-grade fever, and she was urinating very often, decreased urine output, and she hurt upon urination. So what happened? Telemedicine visit with a pediatrician, and who asked her mom about these symptoms and other relevant information. Without doing laboratory testing, the physician, just by with the mom and the child, was able to determine that Madison had a urinary tract infection. Physician, pediatrician phoned in a prescription, and it's crucial to do a follow-up telemedicine visit or a follow-up visit. And this is a class question for you guys to ask your class. What question do you think the question needed to ask or needed to know in order to make this diagnosis? Remember, we're not doing a urinalysis. We're not doing a culture. All right, I'm just checking my time. All right, these are some rubrics for you to use. Here we have for the patient. Here we have for the provider. Again, you could print these off, and this will be quick. Medical coding. What is that? So basically, medical coding is you're using letters and numbers for procedures and diagnoses. And years ago, you used to go to the doctor and they would pull off, the pink part, and it would say, file it with your insurance. Well, they would have the medical coding on there, why you came to the doctor. So you need a lot of different codes for different procedures and diagnoses to keep this massive amount of information organized. There are procedure codes that are used for medical record documentation and laboratory results, et cetera, et cetera. We talk about 3 universal systems, but we're only going to talk about the first 2, which is the CPT code, which refers to a set of medical codes used by healthcare providers describing the procedures and actions they perform. Like a urinalysis, that would have a CPT code. Here we got on the bottom, CPT code, vaccination code is 9130. Now we have this ICD10CM code, and this is a list of code that just came out maybe 4 years ago. It's very involved, and it's used for classifying the diseases. So and I'm going to show you some of these in a moment. So for example, 606.0x or 0x1A is a concussion with loss of consciousness of 30 minutes. That would change to a different code if it was loss of consciousness of 60 minutes. That's how complicated it is. And the HCPCS, they also use the CPT codes, but it's mostly involved with Medicare and Medicaid. I'm not going to really go into this because we don't have time, but I want to show you our activity using medical coding. The student are going to have the code on the left, and they're actually going to Google this, and the code will come up. And I wanted it to make it fun. So look at these diagnoses. Walked into a lamppost, burned due to water skis on fire. Are you kidding me? These are actual ICD codes, promise you. Pecked by a turkey, really? Injured while sleeping, sucked into a jet engine. I have the URLs on top of it for you guys, for their absurd codes, but they're true codes. So if you want to have fun with the kids, use it. You can't afford to buy these ICD codes. Too expensive. And there's the answers. And I'm going to let Erika finish this up with she's going to just take over the screen.
Okay. The webinars that we have, this was probably the one that was the most, I guess, lecture oriented that we have. A lot of them have activities. So if you go to our website, which is on our thing, feel free. We have worksheets, workbooks. We have the webinars, and the PowerPoints are right here. We have different activities, and then we have some products down here where we've taken our different modules that we have from the books, and we put them here. They're $12, but excuse me, Ellen and I were just talking about it. And someone asked on Facebook, why is this webinar not up, or this module? This module will be up by Friday, correct, Ellen?
It's ready to go.
Ready to go. And because we're doing so many webinars, I put in, but if it doesn't work, let me know, code that if you put in webinar, you get $5 off of anything that you get off of here. So if you're looking for this one, come back on Friday, and then you will be able to get this module for $5 off. And they're normally here at 12. If you're like, I don't remember the website, but I remember those two crazy ladies, Lucy and Ethel, and I know that they had this stuff, and I remember the name. We're also on Teachers Pay Teachers, but is full price there, $15 and no discount codes. But please contact us if you need anything regarding this from us. Our information is on let me pull it back up. I'm like you guys when it comes to teaching. Pull this off, share the screen, pull this up. I forgot to add the sound kind of stuff. But we have a YouTube channel with some videos. The videos are like 3 to 5 minutes on different little topics that the students would know. That's a good opener for when you're doing blood pressure, weight, things of that nature. And for the OSHA and HIPAA certification, you can contact Ellen at esquaredhomeschool.com.
And I'm putting my phone number in the chat.
Process.
Okay, my phone number is in the chat. I will get back to you. I promise.
And the webinar, the code for the discount was webinar, correct?
Webinar, yes.
Okay.
And if you guys, if those of you that are in Michigan or Kentucky or whatever, and if you like this, maybe tell your health care specialist, health science specialist at your state, and maybe we could join you in Michigan or Kentucky, where
Lucy and Ethel like to do road trips. We were just talking about a road trip where she tried to kill me going to Savannah one time. So I guess you already know who's Lucy and who's Ethel, but she drives like a New Yorker. this was just the one that we're working on now, and I was telling Ms. Allen about is testing 101. I think somebody was asking about preparing the students for the end of course test or those competency tests. So that's going to be the next one that we do. And we're going to try to make it as fun as possible. I'm using some of my background as a teacher support specialist to actually help help with some of the strategies so that you're not going crazy, because I hate teaching for a test.
And this is in Georgia, and if you're interested, contact our health science specialist, and maybe will allow you to join. We'd love to have you. The more the merrier.
Yes, so I know it's 5 o'clock. Are there any questions that anyone may have before we have to say goodbye?
I'm putting, I am just putting the name of our health science specialist. Oh no, that's the wrong one. All right, does anybody have any questions?
Thank you guys. I really enjoyed doing the chats with you guys. So like we said, our information is on here. Feel free to contact us on Facebook. I was answering some Facebook questions from some of you while we were on here while doing the chat. So it might look like I've tuned out, but I did add some stuff. I guess while we're on here, I guess the last minute, I'll talk about a couple of things that.
Still?
Hello?
Hello? I think.
Okay, a couple of things that Ellen mentioned when she was talking about demographics and the EMR and the EHR. I usually talk to the students about why demographics are important. So when she was talking about blood pressure, we talked about lisinopril and how with COVID and how you have to have a certain number of people from different demographics to test stuff to see if we react very similar. So the lisinopril was an example that we used for that because over time, a lot of people of African descent started having anaphylactic shock related to the medication. So they had to switch a lot of people off. So that's one of the reasons why they would have to know demographics. And then we see it with COVID when they were trying to do the vaccine, they couldn't roll it out until they had people from certain groups to participate in the study. So those are the kind of things I like to talk about.
All right, guys. Sorry we kept you a couple minutes late. You're free to go.
Thank you so much, Ellen and Erika. We
Thank
look forward to
you.
having, we'll have
We
this
always love
posted.
to do these.
Okay,
Yes,
we'll
love
have it on
being
our
with you
website.
guys.
All right.
Hope you had fun. We did.